Welcome to Faith and Freedom. For the next few minutes, we hope to inform, inspire, and encourage you as we discuss the legal victories and challenges to your fundamental freedoms and religious liberties. Faith and Freedom comes to you from Liberty Counsel, a civil liberties education and legal defense organization. Join us now as Matt Staver, the President and General Counsel of Liberty Counsel, explains the latest legal issues all across this country in the courtrooms of America. Liberty Counsel is winning the battle for your constitutional freedoms.
President Obama recess appoints Dr. Donald Berwick as the death panel czar for his new health care proposal. I am Matt Staver, founder and chairman of Liberty Counsel and dean of Liberty University School of Law. Joining me is Matt Barber, director of cultural affairs for Liberty Counsel and associate dean for the law school. You know, during this debate over the health care bill, Sarah Palin used the term death panels, and of course, the Obama administration went nuts, saying there is no such thing, that he's not going to take care away from your grandma. Your grandma's going to get all the care she needs. Now, in fact, what he's done is he couldn't get Dr. Donald Berwick to be the head of this Medicare, Medicaid program under this new health care proposal, this new health care bill, because of all the problems that would come up during the Senate confirmation. So while the Senate's on recess, he recess appoints this guy. Now, who is Dr. Donald Berwick? This guy is a socialist. He believes that the medical system in England is the best in the world. The Great Britain single-payer socialist model, rationing-based healthcare system is the best healthcare system in the world. That's the guy who has been appointed to head up this healthcare, Medicaid, Medicare section of the bill.
Yeah, this is the NSA, the same program, or the NHS rather, the same program that leaves patients in ambulances for hours and hours so that they can meet the requirement that nobody sits in an emergency room for more than 4 hours. This is the same healthcare system that constantly refuses to give life-saving medicine, even basic medication to individuals, even though a doctor has said this is what this individual needs to survive. This is the healthcare system that this man wants to emulate here in the United States, where healthcare rationing is central. It's fundamental to Great Britain's healthcare system, and we have seen what a complete debacle. This is one of the worst healthcare systems that we've seen because it is rooted in rationing and because it is a single-payer healthcare system, the same system that President Obama has said that he advocates, a single-payer healthcare system.
That's right. Now his recess appointment of Dr. Donald Berwick is the new administrator of the Centers for Medicare and Medicaid Services. Now, Berwick is one of these Harvard elites, and Obama is stacking the administration with all of these Harvard-type people who have not run a private business. They've not had to balance a checkbook on a private company. They don't know how to supervise people in a private environment. They're academics from Harvard who think they know better, and they're going to tell the American people, you little kids, we're going to pat you on the head and we're going to tell you what's best for you. And this is the guy who ultimately will ration health care. He is supposed to get the cost of Medicare and Medicaid under control, which I understand we need to do that. On the other hand, his idea of doing that is to ration care from the elderly, because he believes that that is the best way to do things. And in fact, that's what happens, like you said, over in Great Britain. They've rationed care from people because of certain conditions that they have, diseases, or their age, because they don't want to put enough money into those people because they're not productive citizens. There's not a sanctity of life idea. There's just a production. If you don't produce enough for me, I'm not going to give enough money for you. So I'm going to ration the care from you because you're not a productive citizen. He buys into that idea, and that's what he's going to do. He's going to reduce the cost by rationing care from the elderly, the needy, and those who are sick.
And there's another side of this, too. This is the politicization of health care. Berwick, like Obama and like so many others, they don't see that health care is central to health care reform. They see that imposing socialism is central to health care reform. This is not about health care. It's not about quality health care. It's about power, government control, and as Berwick himself has stated, it's about the redistribution of wealth. He has said that health care, and that the healthcare system must be used necessarily as a vehicle to redistribute wealth from the haves to the have-nots. This is Marxism 101. This is the Communist Manifesto 101, and this is fundamental to this man's interpretation and ostensibly, not even ostensibly, I think we can guarantee that this is how he will govern and how he will administer the healthcare system once he gets in control.
That's right. Now, you know, David Axelrod said on Fox News that Berwick is not going to implement the British-style healthcare system. But that's what he loves. He believes it's the best system. He has actually received awards, I believe. In fact, he even was he's even called sometimes Sir, Berwick, Donald Berwick, because of his work in Great Britain on their system. He thinks it's the model for the world to follow. So this guy, who is very clear about his model for the world to follow, when he gets now in this position to be head of the Medicare and Medicaid, what's he going to do? He's going to model it after his ideal. What are you going to do? You're obviously going to do that if that's what you believe is the best system. It's not the best system. Obama indicated when he was running for election, it may take 5, 10, 15 years, but I will bring forth a single-payer system where the government and no other private company is involved. That's what Berwick likes, that's what Obama wants, and that's where this system is going if we don't ultimately stop it.
That's what I was going to say. It's no accident that Berwick holds these views and that